and any part of this globe where you could be joining us from. My name is Dr. Mercy Korir from the Kenya Medical Association, the SACO, and we will have probably an interesting and a one-of-a-kind different webinar from this hour to about 8:30, so 1.5 hours, where we get to listen about possible opportunities in the diaspora. So we'll give about 2 more minutes for many of the other participants, SACO members and non-SACO members, to join us, so that once we start, we all start on the same footing. So for anyone and everyone joining us, please feel at home. We'll start in the next 1 minute. Thank you. Okay, good morning, good afternoon, good evening, everyone joining us from any part of the globe. This is one-of-a-kind webinar by the SACO, Kenya Medical Association, SACO, and so we welcome all of you. Our topic today is diaspora opportunities for doctors. And so we reached out to some of our colleagues practicing in different parts of the world, and we have representation. We'll get to hear from them from the UK, to hear about what opportunities are there, what their experiences are, what and how they manage to be able to work in a foreign country, and if at all they encourage us to go and join them wherever there is. So it will be an interesting conversation this evening, and we welcome all of you. For this particular session, we encourage a lot of questions from all our participants. I know everyone is always thinking about what else can I do? What other opportunities can I look for? So this is the opportunity for you to take notes on that. If you have any questions, please put them on the Q&A option on the chat, so that our panelists for today are able to answer all your questions. We'll be able to field the questions to the panelists during this particular conversation, and we'll be able to hopefully answer, if not all of them, as many as possible during this webinar. So the program for today is, we'll start after this brief introduction. I'll introduce to you who our panelists are, where they come from and what they've been doing, but then they'll have a detailed presentation about who they are once they start speaking to us. Then we'll hear the presentations from our panelists for about 45 minutes, after which we'll get to the Q&A, and we'll wrap this up at 8:30. So please remember to put your questions on the Q&A option on the chat. If you'd like to ask your question on audio, please raise your hand, and our technical team at the back end will be able to sort that out. So I'd like to welcome all of you. My name is Dr. Mercy Korir. I'm the Vice Chairperson and the Chair of the Education, Communications and Marketing Committee at the SACO, and I look forward to having an engaging interaction with you. On our panel, 3 doctors from the diaspora. We also have other board members who have joined us, who will be able to also just answer some of the questions related to the SACO that you may have, because this is also an opportunity for you to reach out and be able to talk to us as the SACO, so that in this kind of opportunities, we are able to interact and answer some of your questions, sort out some of your pressing issues. So without much further ado, let me just introduce to you briefly who our panelists are. First, we have Dr. Phyllis Mohia, who's a dental surgeon, and she has you know, when we look at somebody like Magoha and many titles after his name, Dr. Muhia has one of those. She will tell us. She's a dental surgeon who decided to explore the community dental services in the UK, and she'll be telling us more about what she does in the UK and what opportunities are there for the dentists. Also with us is Dr. Catherine Ngovo. Dr. Ngovo is a clinical pharmacist at the Southeast Oxford Health Alliance. She'll be able to tell us what opportunities are there for pharmacists in the UK, what her experiences are, and so we'll be able to hear from her. Later on at 8 p.m., we hope to be joined by Dr. Kevin Kamande, who is a pediatrics trainee at West Midlands. He says this is a highly sought after location for pediatric training. This is also in the UK, so we'll be able to hear from him at 8 p.m. He had some work to do, so he'll be joining us later on. Then last but not least is Dr. Omar Tayari. Dr. Tayari is also a medical doctor in the UK from the Kenyan Diaspora Doctors. So we are able to reach out to these particular doctors and they are able to put up this team. And as you can see, it is representative from the medical practitioners to the dentists and to the pharmacists. So we'll be able to hear, you know, through and through, cutting across all the three professions of the doctors and who are the main members of the circle. So without much further ado, allow me to welcome Dr. Ngovo, clinical pharmacist at Southeast Oxford Health Alliance, to take us through her first presentation. Daktari, karibu sana. We can see your screen, Daktari. You can just put it on full screen and then you can start. Yes, now it's on full screen.
Yeah. Hey, hello everyone. So I'll be talking to you about
please just mute if you have. Thank you. Okay, continue, Daktari. Sorry for that.
Hello everyone. So thank you. I'll be talking about opportunities for pharmacists in the UK. And my objective today is very simple, just to give you practical tips and show you the possibility of pharmacists relocating from Kenya to the UK and taking up some of the opportunities. But let me just start by introducing myself. My name is Catherine. I was born and raised in Kenya. I did my pharmacy degree in Kenya. And right after my internship, I came over to the UK. I have been a registered pharmacist now for 14 years. And in those 14 years, I've done different roles. My current role is clinical pharmacist in primary care. So basically, we are doing optimization of medication, especially in long-term illnesses. I am doing medication reviews. My area of interest is diabetes. So yeah, that's my current role. But I'm also a published author. A few years ago, I realized that you get more respect as an author as compared to pharmacy. So I wrote a book. Please do check it out. It's on Amazon. My email address is theasingovo@nhs.net. I just put it out there because maybe there will be some people who want to reach out to me. Please feel free to write to me. So I'll right away begin by telling you some of the opportunities we have here in the UK. There's community pharmacy. It's a well-thriving area to pursue. There's hospital pharmacists, and under that, there are so many things one could do. There's oncology, renal, anticoagulation, acute care, mental health, and a lot more. There's primary care pharmacists. So it's the area I'm in now. It's recently introduced, so we still growing it, but it's around setting out formularies, guidelines in which medication to use. Of course, cost effectiveness is a big thing for NHS, so we do some of that, but it's also actually dealing with patients in primary care, just making sure there is safe transfer of care from hospitals to primary care, making sure patients are getting, optimization of their medication, especially if they have chronic illnesses. And then there is prison pharmacists, roundabout substance misuse and helping them with things like methadone and buprenorphine. Then there's industry. In industry, again, it's a very wide area. There's design, manufacturing, quality control. It's not an area I know much about, but I do know some colleagues who are actually in that area. Then there is research and academia. Again, not an area I know too much about, but it's there for those who want to pursue it. So, but how do you get to actually pursue these opportunities? So a lot of those opportunities I've talked about, I will show you the difference as I go on with my presentation. But for most of them, you need to register as a pharmacist. So to get to register as a pharmacist, the first thing you need to do is the main difference, actually, why there is a slight difference between working as a pharmacist here in the UK and Kenya is because the entry level of a pharmacist in the UK is master's, while in Kenya is a bachelor's degree. So then when you come over, you need to go through a really long process so that you can, they can actually like get you on their register. And to do that, the first thing you need to do is apply to General Pharmaceutical Council. And for them to even look at your application, you need to do the English test, and they need to look at your pharmacy qualification. So they look at the transcripts, they get reference from the university. You get one of the lecturers to give a reference. So that's the first thing. Once you've done that, then they will allow you to apply to do the Overseas Pharmacist Assessment Program. And that's a program offered by a university. As far as I know, there is a University of Sunderland where I actually did my own course. There is Brighton University and there is Aston University in Birmingham. So once the General Pharmaceutical Council gives you the go-ahead, then you apply to the university just like another course. Then they look at your papers, they offer you they offer you the vacancy, and then once you pay, you can apply for your student visa. After you finished that course, it's actually a full academic year, totally intense course. After you finished and passed the exams, you then carry out a 52 weeks pre-registration training or internship. Now, it is a paid internship. NHS England pays for it, but to do it, you need to get a work permit. So you find an employer who is willing to get a work permit for you. After you finish the 52 weeks, then you need to do the registration test and get a pass result. At that point, then you apply again to General Pharmaceutical Society for registration. So let me just talk a little bit about immigration, but I just want you all to know I'm not an immigration expert. You need to look out for information on the immigration website. The information changes so often, so it's something that you just need to check out for yourself. But what I know to this point, and I have researched even before my presentation, is that to do the Overseas Pharmacist Assessment Program, you need a student visa. To get a student visa is actually a straightforward process. You need to show the university you've got full fees. You can pay the full fees. So it's around about £10,000, but also you need to show that you can support yourself for the time that you'll be studying. While you're studying, you're allowed to work 20 hours a week, but even without considering what you'll be earning, you still need to prove that you can support yourself. Now, the other thing I need to say about immigration is pharmacists at the moment is in the shortage occupation list, which means that employers do not need to show that they've tried to recruit from other places for them to sponsor your work permit. So it's a big advantage and something that we should really take advantage of at the moment. the other thing I need to say is for pre-registration and work, if you're coming from Kenya, you need to get a work permit. Now that depends on the employer. A lot of employers will be willing to go for it because, again, as I said, at the moment, there's a struggle to get pharmacists. So they'll be more than happy to sponsor you to get a work permit. After 5 years on a work permit, then you can apply for to get a visa to remain in the UK. Now, another route that I just need to point out is you can come over on a student visa, pursue a master's degree, but go for jobs that do not need you to be registered. Like, for example, industry jobs, research jobs, academia jobs. You do not need to be on the register for that. So that's another way. If you think maybe you want to do quality control, you do not need to be on the register for that. It's always a good thing to be on the register, but if you think you will never be interested to do clinical practice, then another route is just to do postgraduate study, get an employer to sponsor your work permit and just stay at that. So how easy is it to find work once you're registered? It's actually very easy. Every single day, I get emails just with job offers asking me if I'm available to work, but I can only do one job at a time. So I just mostly decline. So just to tell you that there's a lot of work out there for pharmacists if you're willing to take the opportunity. But my presentation today would not be full truth if I did not tell you that there are challenges to pursuing those opportunities. First and foremost is there's lack of family support. I know when you're in Kenya, this is not a big deal, but actually when you come over here, it's a big deal. You miss out on your family, you are on your own, there's no one to prop you up. So it's just something to think about. Now, the second thing is the time. Even if you get everything right, you get to apply for the university on time, even if you get to write your registration exam on time, even if you start your internship on time, it's going to take you at least 2.5 years. That's how long it took me. So just bear that in mind. It's going to set you behind by about 3 years. But what's 3 years? If you think you're going to enjoy working in the UK, if you think you're going to settle here for a few years, what's 3 years, if you look at it from the big picture. And the third point, which is equally important, is it's a very costly process. You have to think you're going to need to pay for university study. It's going to cost you around about £10,000. You're going to have to support yourself while you're a student. When you start to do your pre-registration, as I said, it's paid internship, but up until that point, you need to be able to pay. So the cost is a major thing to think about. And then there is immigration and visas. Now, it can be incredibly frustrating to pursue visas, to deal with all the immigration law. Again, that's just something to bear in mind when you're starting the process. But I want to conclude by my presentation by quoting a few beautiful words from my favorite book, that all things are possible to him who believes. And I just put up some websites there for you to check out. Please do look at www.gov.uk. It shows you everything you need to know about immigration, and pharmacyregulation.org tells you about the registration process in detail. Again, my email address will be available if you want to reach out to me. Thank you very much.
Thank you very much, Daktari, for your presentation. I've already noted a few questions. So for those who have joined us a bit late, today we are talking about opportunities for doctors in the diaspora, and we have representatives from our own community who are working abroad in the UK to tell us a bit about their experiences. You are just hearing from Dr. Ngovo, a practicing pharmacist, clinical pharmacist, and a published author. She's told us you can get her book on Amazon. Daktari, somebody's asking for your email address. You can just put it on the chat. But for everyone joining us, please place your questions on the Q&A option of the chat box so that we are able to track your questions and be able to answer all your questions at the end of all our presentations from all our panelists who are here with us today. So next, allow me to welcome Dr. Phyllis Mohia so that we hear from the perspective of a dentist. Please keep your questions, have them on the Q&A, or you can raise your hand. We'll be able to work and have you ask your question on audio during this webinar. But next, let's hear from Dr. Phyllis Mohia, a dentist. Karibu Daktari. Perfect. We can see your screen. Please proceed.
So my name is Phyllis Mohia, and I have been here in the UK for the last 16 years. I qualified in University of Nairobi in 2004.
Daktari, sorry to cut you short. We cannot see you yet.
Okay, just 1 second. Technical difficulties. Right. Okay, there you go. Can you see me now? Seems like you're controlling it, Mercy, though.
No. Now we can see you.
Okay.
All
Yeah.
right.
So I graduated from University of Nairobi in 2004, did my internship in Kenyatta National Hospital, and then I decided to explore opportunities abroad. So I enrolled in what was the international qualifying exams at the time, the IQE, and it's part of the journey I'm going to share today. So currently I'm working in primary care as a senior dental officer. I've not started sharing my PowerPoint, so I'll start now. Now that Mercy has started my PowerPoint presentation. I don't know what's going on.
Oh, we've shared it for you.
Oh, you're sharing, okay.
Yes.
So what you need to do if you're applying for the overseas registration exam, which is a current ORE as a dentist, you need to complete an online application form on the EGDC platform. And then you need to submit the required documents. You need to also apply to do the English language testing exam by the British Council. Currently, I think the score is about 7 out of 9. I've attached a link on there. The applicant also must have at least 1,600 hours of clinical dental practice. And this can either be accrued from either the dental practice within the dental degree or as a postgraduate or post-qualification experience. So once the applicant has applied for these ORE exams, then they are put on a waiting list. So I'm going to go to the next slide. And the candidate is emailed when a new exam date becomes available for the booking. Now, OREs consist of 2 parts. You've got part 1 and part 2. Part 1 has A and B, which sort of tests you on your clinical dentistry, law and ethics, health and safety, and this is a computer-based exam. Usually it's first come, first served. You have to actually book the exam and also come to the UK. At the moment, it's being held in King's College London, which is a KCL. So the next part, after the applicant passes the ORE part 1, they then enroll to do the ORE part 2, and I've put the figures there of how much the exam is at the moment. You have to pass this part within the first 5 years of attempting part 1. Part 2 is more comprehensive because the applicant has to do an operative dental mannequin test. They have to do a diagnosis and treatment planning case. They have to do some OSCEs, medical emergencies, and a basic life support scenario as well. All this information can be found in the GDC website, which is a General Dental Council, preparing for practice document, and I'll attach the link later as well. So once the applicant has passed the ORE part 2, they then can actually prepare to register with the GDC. But for those ones who want to start thinking of preparation courses, there is a website, the Samson Clinical Courses, that offers the PLAB courses as well as the ORE courses here in the UK. So this would be a good tool for anybody who is thinking on trying to start this journey at the moment. Now, once you've passed all the exams, it's really straightforward. You just apply on the GDC website and you become a fully registered UK dentist. At the time, you'd have to pay what you call the annual retention fee. And then every dentist in the UK has to have dental indemnity in order to practice here. So that is part of the package. The dentist has also to commit into a continuous professional development cycle. So every dentist has to accrue about 100 hours every 5 years. Okay. There is an alternative route, which is the LDS route. This is offered by the Royal College of Surgeons in England. The benefit of this route is that actually the dentist gets a post-nominal qualification letters next to their qualification. So it becomes like a diploma, which is awarded by the RCS England. Now the exam is more comprehensive. The LDS exam is more comprehensive as well. It's got part 1 and part 2. And the requirements, although very similar to the ORE, you need to apply also for what is called a NARIC equivalent statement. So basically, your degree has to be scrutinized by this body and compare whether it's comparable to the UK dental graduate degree. The other thing you need to do is have authenticated Hep B, Hep C, HIV certificates as well, letter of good standing from the dental authority in which the applicant qualified. So the LDS route is not very popular, but again, it's another route that any practitioner can actually pursue. Now, once you finish all the exams, working in the UK, there are loads of dentist jobs here in the UK. Patients are desperate, the waiting lists are so long. However, there is the immigration rules as well, just like Catherine has said. There are several pathways for applying for immigration sort of status here as a dentist. The first one is a skilled worker visa, which most of the corporate practices are offering now because they're desperate actually. Then you've got the secondary care, which is your main hospitals, NHS trusts, and this, they apply for your work permit. The other pathways, if you've obviously got a spouse, then you come in with a spousal visa. And obviously for more information, anybody can look into the UK Home Office website. And then we're gonna go into the career pathways that you can pursue as a dentist post-registration exams here. There are several career pathways. I'll discuss the first one, which is mainly working for the NHS. You would need to apply for a performer's number, which again might sort of be a bit difficult or a barrier for some dentists because you have to apply for what you call vocational training equivalence. So a bit like our internship. So you would have to do a portfolio, some case studies, and then the postgraduate dean of the area you're applying in would decide whether you need to do vocational training or not. And if so, how many months do you need to do? Usually the maximum is an year, so it's not too bad. After you've got the performer's number, you can then apply to work as an associate or work in community dental practice. So I work in special care dentistry. I treat patients under general anesthetic, children with inhalation sedation. So you can go into community dental service and do that kind of specialized dental practice. Or you can work in a private associate dentist practice. You know, you don't need a performer's number for that. You can work in secondary care, which is part of the maxillofacial department. Or you can decide to go into academia and do research or teaching as well. Some dentists actually come here, and especially from India, they take the opportunity and actually work as a hygienist or a dental nurse or a dental therapist as they pursue the exams. And it's becoming very, very popular at this time. So if somebody is considering that, that's a very good pathway. And you just need to register like any other hygienist would register as well, but the process is actually less tedious as well. Right, the next slide, please, Mercy. The other way of registering with the GDC is temporary registration. This is not very popular again because it's mainly for those dentists who are coming here for a short period of time. They're mainly coming here to work under supervision as well, and they're usually pursuing training posts. However, some dentists utilize this temporary registration as a time to also pursue the full GDC registration. So although I'll mention that pathway as well, although it's less popular anyway. Okay, and then, so those are my references. The LDS exam is held by Royal College of Surgeons in England. The ORE exams are held by the GDC, and obviously all the links are attached there. Now, if anybody has any questions, I'd be happy to answer. And I'll leave you with one quote from Henry Ford that sort of says, if you can or you can't, you're right. Thank you.
Thank you very much, Dr. Mohi. I can see there are many questions coming in. I'd like to encourage all our participants, please post your questions on the Q&A. We'll ask our panelists as soon as we get to hear from the next panelist. Please post your questions on the Q&A. I'll be able to front them to our panelists. Somebody's asking about CPD points. Yes, we'll provide CPD immediately after this. And also a recording of this webinar we'll be able to share with all our members after this particular webinar. But we'd like you to actually ask questions to our panelists, because as we said, this is a webinar specifically just to let us know about what opportunities lie out there that we can tap into as a SACCO community. So next, allow me to welcome Dr. Omar Tayari. Dr. Tayari was not really scheduled to speak because we are waiting for Dr. Kamandi who will join us at 8 p.m. But I'll give Dr. Omar a few minutes just to say something. Omar is the head, I found this interesting, the head of fitness and environmental illness at the UK Armed Forces, works with the UK Armed Forces. So Dr. Interesting path that you went into in the UK. The floor is yours.
Yeah, thank you. I think for many people who might know me from the past, have known me to be somebody who was really interested in sports, and I was sports council chairman for the University of Nairobi Medical School for a while. So I ended up pursuing that side of things. So like you said, I wasn't really scheduled to speak, but a few things just to bring to your attention. The first one is I'm here in my capacity also as the General Secretary for the Kenyan Doctors in the UK, which is a newly formed association which brings together doctors, dentists, and pharmacists into an association that really voices out some of the issues affecting Kenyan doctors working in the UK. So with that, I'd like to invite Dr. Ngovo. I don't think you're part of us, so please join us. Please sidebar me. And we can add you to our group. The other things just to mention while I'm still here and allowed to speak is the alternative. I know Dr. Kevin Kamandi is going to speak about kind of the more traditional pathways into medicine, but I followed a different alternative pathway in terms of medicine. I do what I love, which is just playing around and just having fun. And this is probably what I'm going to share with you, just a few of the alternative medical opportunities for doctors specifically. So if I'm allowed to share, I am going to try and do this. So if it's full screen, yeah. So that's essentially me. So I am a civilian medical officer. So I work for the armed forces, but I don't carry weapons. I don't carry guns. So I'm a civilian. And I head the fitness clinic for the Royal Navy. And I also head the environmental injury clinic for the armed forces in general. So it sounds big, probably it is. What I'm going to say today is my own personal views. I've got nothing to do with the Royal Navy or the institution that I work for. So that's where I work. And essentially, I'm just going to give you a brief into my pathways. So this is my unit. In there, there's underwater medicine, which I do in terms of doing medical assessments for divers, so divers within the military. And then I also, so where I work is the Royal Navy's medical school. So the doctors, nurses, people like that come here for specific training, survival, and that sort of thing. And I'm faculty in that area. So you can join the armed forces in the UK as an officer in the forces. So uniformed. So you can be a doctor in the Navy, Army, or in the Air Force. And this is kind of the website. If you go through, you'll see some of the opportunities there. The other alternative pathways is occupational medicine. So you can do a diploma in occupational medicine and you can pursue that as a career, and it's very, very lucrative. I've actually done some of this work in my previous time before joining the armed forces, and it's well paying. So don't just think, ward patients, surgery, these jobs are kind of 9-to-5 jobs, so, and no weekends, so that's is probably a plus. Aviation medicine, so you can do a course in aviation medicine, medicals. This is something that I want to do personally, and it's in line with some of the work that I do here, so I'll be pursuing that. So again, very lucrative. It pays well. It's very interesting. You get a private pilot license, which is also good. And then disability assessment. So in Kenya, I found out that recently there's the National People with Disability Commission or something like that, where the intention is to do medical assessments to look at the functional ability of disabled people to determine how they can be supported by the government. So I used to do that work. So before this life, I used to do that. Again, very lucrative, very well paying. It probably pays more than many other jobs that people can claim to earn. Palliative medicine, also an alternative pathway. So you've got to be a physician first, and then you can go into palliative medicine. Very rewarding for the people who enjoy that. Some people come to the UK and choose to become locum doctors for a long time. It's nice in the sense that you get paid really, really good wages. But the problem with this is that you don't necessarily have a pathway. So you be one place one day and then another place another day. So you don't have that continuity of demonstrating how you're progressing in your career. But some doctors from Asia have done that. And these are people who are very, very rich, some of them as medical people. Because one thing is you'll not be rich as a doctor, but doing this you might be. Expedition medicine is also something that interests me. I have just recently been approached to write a chapter on expedition medicine in relation to environmental medicine. So that's coming up. I'll probably be on Amazon one day selling books. And then kind of moving on, public health, some people, even within the Kenyan doctors in the UK, I know somebody there who's doing public health as a specialty. It's quite nice. So especially now with COVID, public health is the thing, isn't it? So health insurance, just like in Kenya, post-injury, post-accidents, fitness to drive, that sort of thing, also lucrative. You can do it as an alternative pathway. Medical writing and academics, for the people who love that, it's there for you. Forensics is also a very interesting pathway. Prisons and police. I know Dr. Ngovo spoke about prisons, so you can also be a doctor within prisons and do that. And just finally, the Kenyan Doctors UK as an association, we are trying to be the voice of the Kenyan doctor in the UK. So as you're planning to come to the UK, know that we're there. Know that we have so many years in terms of advancement into life in the UK. So feel free to get in touch, and we'll be there on hand to assist. And just finally, so that's the end of my kind of slideshow. But finally, you have to think about two things when you're coming to the UK. And the first one is the social aspect. And I know Dr. Ngovo mentioned something about it, is that when you come here, you'll be isolated. For example, in Kenya, so you as a man, as a man, a doctor, you have a job, you're feeding your family, and that's fine. It doesn't matter what your wife's doing. But when you bring your wife here, for example, remember, she will not have a job. She'll be stressed, she'll be at home, she'll be able to take care of kids. And if you reverse it, so if your wife is the doctor and you're not a doctor yourself, you come here, are you prepared to be a husband, for example? Or even when both of you are doctors, you have to remember that as you make that transition to the UK, both of you are likely not to be employed at the same time. So kama bibi anaenda kazi, mzee utachange nappies nyumbani, roho safi, just accept that, you'll be fine. But those things play into your mind and can easily damage your relationship with your spouse. So be prepared of that. And the last thing to remember is, we recently had a conversation with Kenya Medical Board, the Kenya Medical KMPDC, And many doctors coming to the UK forget to inform the KMPDC. So you might have this bill accruing of your membership? No, registration fees in Kenya. So yeah, so be sure to inform them before you board the plane to come here. But like everyone has said, there are plenty of jobs for everyone at every level, from entry level all the way to consultant level, and we're there to support you. Thank you very much for the opportunity. I will keep quiet.
No, we will definitely ask you questions, and I can see there are quite a number. And I think the conversation you started on work-life balance is key on relationships and how they can be affected by the strain of, a new country, new jobs, and, trying to find a footing. So I've seen a question to that effect, which I will pose to you, Dr. specifically. I'd like to ask all our participants, please post your questions on the Q&A side of the chat so that we're able to pose them to our panelists. We have one more presenter who will join us at 8 p.m. Dr. Kamande, once he's in, we'll be able to give him an opportunity to give us a presentation, and then we can ask him questions. But Dr. Omar has given us a bit of some of the opportunities that we can engage in, and Dr. will specifically be asking about the medical writing. Let me start with Dr. Ngovo, a question here from Jacqueline Gogi, and I'd actually flagged that about the 20 hours a week. What kind of job would that be? And as Dr. is asking here, in those 20 hours, is the money you get there enough to cover your cost of living?
So first of all, let me just say that, as I said in my presentation, the course that you need to do, the overseas pharmacist program, it's actually intense. So you'll be lucky to get 20 hours a week to work, but I did it because I needed the money. And the work that you do is up to you, really. You could work in a pharmacy as a technician, dispenser, you could work in a supermarket. I mean, it really doesn't matter. It's up to you what you do. Really, the main thing is just raising some upkeep money. So if you're willing to do any kind of job, there will be jobs. The only one job you cannot do is work as a pharmacist. And that is humiliating, but you just have to accept, you're going through the process. And the second question about whether the money will be enough, no, it will not be enough for your upkeep. Now, if the lady who asked the question, feel free to check out the current, the amount of money you need for your living expenses in the UK. I cannot remember right now how much it costs, but I know 20 hours a week is not actually enough for you to pay for accommodation and for all your other bills, but it does help a lot.
Okay, thank you for that, Dr. Let me just ask you this one. Okay, this is an anonymous attendee. Is it possible to enroll for the master's fresh from university with only one bachelor's degree?
Absolutely, yes. Actually, master's opportunities are very easy to get. I mean, getting a university admission in this country is one of the easiest things. The limitation, number one, is just proving that you can pay your tuition fee and your living expenses. So it's really around getting a student visa. But in terms of just getting admitted to university, that is absolutely easy.
Mm-hmm. Okay, thank you for that. Let me go to Dr. Muhia. Dr. Kamande, welcome to the webinar. I'll give you an opportunity in a few minutes. Let's take a few questions and then we'll come to Dr. Kamande. And for Dr. Muhia, okay. Pamela is asking if for dentists wishing to pursue the ORE, the overseas registration exam, is there an age limit? Supposing somebody is over 50, can I?
No, there's no age limit, but you have to, I mean, it's quite intense. Finished,
but I'm actually on a presentation.
Okay.
Yeah, sorry about that.
Hello?
Sorry for that. Please continue, Dr. Muhia.
Yeah, there's no age limit for registering as a dentist in the UK. As long as you pass the exams and follow the protocol, it's straightforward. I can see another question there about corporate dental clinics offering relocation allowance. Very rarely. I mean, I think up north, you might be able to get some of those packages, but you should be ready to pay out of your pocket, but you'll get that money back. I mean, dentistry here, you can't make money if you want to go into private practice, if you're not too worried about work-life balance. I mean, I'm in community practice because I like the work-life balance. But in terms of getting that money back, you know, you will get it back. So as long as you can do the exams and get the sort of work permit and all that immigration that is required, it should be okay. So most people pay out of their pocket. I did.
Mm. So there's return on the investment.
Oh yeah, there is. I mean, the first job you get, you'll be, you know, you will be able to, there's a lot of good return on investment. Yes.
Mm-hmm.
It's whether you can actually do the exams and pass them, really.
Mm-hmm. What is the paycheck like? And I could see one of that questions. If you compare the peers, okay, let's say at the entry level in the UK compared to the entry level here, what is the pay disparity?
Well, as a dentist?
Yes.
The one thing I'll say working as a dentist gives me is work-life balance. I work 9 to 5, 8 to 4. I mean, it's very flexible. I don't have to be on call. In terms of the disparity, it depends on where you're working. If you work in a hospital trust, then it's almost like working in Kenyatta, so it's salaried. So you're guaranteed of your holidays. If you work in general practice, the more you work, the more you're paid. But it's not comparable with what you'd be earning back home. No, it's not. You wouldn't compare. You'd live a bit more comfortable, I think. And the opportunities are there, you know, every day. I mean, for a patient now to be seen in the NHS practice every day, it's almost like 2 years waiting list. So the opportunities are there for whoever wants to embrace it. Now, what they've done though is that the exam process is so rigorous, and they have kind of a quarter point system. So, you know, we've got a deficit of dentists here, but if they want 10 people to pass, that's what is the main challenge in barrier, actually. But in terms of opportunity, I would say anybody who's ready, especially the young dentists coming out, take the opportunity, go for it. You know, there's good return on investment.
Okay, thanks, Doc. But I could not. You're not speaking figures yet. I will circle back to
figures. I mean, you can comfortably start earning about 50,000 per year. That's what we calculate in the UK. But then the expenses are also quite high. So, you know, you would easily start with that, and you can go as high as you like, but then you work as hard, you got more litigation, dental indemnity, you know, you, as much as you are happy to work harder, then, you know, you'll make the money. That's what I'm saying. But yeah, in terms of figures, that's probably the only figure I can give at the moment.
Okay, all right. Thanks, Dr. Dr. Omar, is the Masters in Public Health paid tuition fees catered for, such as with IMED, surgery, pediatrics, or obstetrics? I don't think I quite understand that. Sorry,
what's the right? So yeah, no. Let me respond to that question. So I think there's one slight misconception generally with people who want to come to the UK. So the UK does not have MED. So that's one thing that we have to be very, very clear. There is no MED in the UK. So what generally tends to happen is, as a medical doctor, you can come straight from internship, and if you're lucky, you do your plubs, you can find work, and then gradually you find training positions as you go along. So the training positions, and I think Dr. Kamande will speak about it, is that you're employed by a hospital or trust. So you do the job for them as they train you, and as you show competence and you progress up to the point where you become a consultant, if that's where you want to go. Now, for things like public health, there might be a different pathway for that, but you will have to demonstrate that that's something that you want to do. It's not a particularly straightforward pathway, so you've got to kind of start doing things within public health, probably do a separate master's degree in public health, but that's separate from the NHS training positions. So to be very clear, There is no MEd, so you cannot just come in and jump into a training position. You can come to the UK, get a job, and while you're doing that job, if you do your job properly, you might be offered a chance to train and improve your skills, or you might enter the race into applying for training positions, just like Dr. Kamande has done, and you will be trained into being a specialist. I hope that answers the question.
I hope I think they're asking about if there's paid tuition for somebody pursuing public health.
Yeah, so just like I've said, if you're doing it as a master's degree, all master's degrees are paid. So you have to pay for it if that's what you're doing. But for medical doctors, unlike pharmacists, you don't need to come to the UK and do a master's. From my point of view, there's no point doing that. Just come here, look for a job, and then get into the specialty that you want. But if you really want to do a master's degree and do public health, then you will have to pay for that degree separately, and then now start looking for jobs within that specialization, if that makes sense.
Okay, all right. So if somebody has already specialized and they have a non-UK master's, what would the process be like? Not necessarily on public health, but is it possible to work with a non-UK master's? Let's say, I think if it's surgery, something else, is it possible to still work?
Yeah, that's a very good question. Now, like I alluded to in the previous comment, and probably Dr. Kamande might also say something about it, is that because there is no MEd in the UK, MEd is not recognized in the UK. So what MEd does to you, it gives you experience working in that field. For example, if you've done MEd surgery, they will say, well, you have 4 years experience doing surgery, but it's not classed as that you've been trained specifically. But what you can then do is you can do an MRCS, for example, after you've done MEd surgery. So when you do your MRCS, you go on to level 3 of surgery specialist training. So level 3 is the beginning of specialist training. So at ST3, it's called ST3, you have your MEd. They will consider the MEd as experience in surgery. So all you have to do is you have to prove to them at that point that your experience warrants you, for example, to be jumped from ST3 to ST5, so that you don't have to go through the same things that you've done already. Okay, but if you cannot demonstrate that you have the competencies of a UK doctor at ST5, then even with your MEd, you will start from ST3 and you will go through all those levels until you get to ST7, ST8, where you become a consultant. So MEd in Kenya, you might be a consultant in Kenya, but when you come to the UK, you are a junior doctor at ST3 level until you've proven yourself beyond that.
Okay, I think that's quite elaborate. Thank you, Dr. Omar. Allow me to, we'll take the rest of the questions after the next presentation. Please post your questions on the Q&A, at the chat Q&A. I'll be able to pick them from there and pose them to our different panelists here. Dr. Omar has put his email address on the chat there where you can reach them. Dr. Mohia, somebody is also asking for your contacts. Please, you can also share with them. But next, for the next 10 minutes or so, I'll allow Dr. Kevin Kamande, who's a pediatrics trainee at ST1 level. And I think at this point, he'll be able to explain to us the ST levels. He's in West Midlands. He says this is a highly sought after location for pediatric training. So Dr. Kamande, thank you for joining us and making time despite your busy schedule. Please, the floor is yours. Karibu.
All right, thank you. I hope you can hear me.
Yes, we can hear you. Please go ahead. Are we
All
able
right.
to see you also?
Oh yeah, I just want to actually present something.
Okay.
Let me see if this works, or I'll actually just share my screen.
Okay, as you prepare your presentation, Dr. Ari, somebody is asking about how do they start as a medical officer in the UK?
All right, So as a medical officer in the UK, actually my presentation really touches on that.
Okay.
So as a medical officer, can you see my screen now?
Yes, we can see your screen.
All right.
Okay, thank you.
All right. So getting to the UK is basically what we are here to discuss. And the first thing that you need to actually get to the UK is get registered. And basically there are three methods of getting registered to work in the UK. So the first one and the one that I actually did was a PLAB route. Second one is Royal College exams, what Dr. Omar was alluding to when it says MRCS, which is member of the Royal College of Surgery. And the third one, which is quite interesting, is actually an international training fellow. Now, secondly, there are two kinds of jobs you can get after getting registered. So one is a training job and one is a non-training job. All right. So how does this go? All right. So if we actually think of a training job, if we start with PLABs, can you still see my screen?
Yes, Dr. Ari, please go ahead. We can see the screen.
So PLAB, basically, I'd usually describe it, is usually good for junior doctors, but can also be done by doctors at senior level of training, people who are in their MMed. Some consultants can even do it, but I'll typically encourage junior doctors to do this. So it typically consists of two parts. So PLAB 1 is basically MCQs. It's 180 questions within 3 hours. That means one question per minute. And PLAB 2 is an OSCE. All right. So initially, to do PLAB 1, what they need is for you to show your ability for English. So that's going to be an IELTS exam or an OET. Now, OET is now available thanks to COVID. You can actually do an OET at home. Initially, it was not available. And I actually went and searched the IELTS. So OET is, people say it's actually easier, but both of these are usually valid for only 2 years, after which they expire. All right. Now, some of the challenges that COVID has brought towards the PLAB examination is that the slots, there's a backlog of slots and they're trying to increase the slots. So the probability of getting a PLAB spot can be very difficult. You'll probably get a PLAB spot within a year from the time you're actually searching for booking. So if you want to book now, you may get October, you may get November, you may get December. All right. Two is that because of the backlog and them shutting down COVID, basically when they actually release slots, those slots fill up in minutes. There is still a chance you may be able to get a slot if there's a cancellation limit, that's last minute cancellation. Basically, someone says that they don't want to, they for one reason or another cannot do the PLAB and cancel. You can actually get a PLAB exam slot quite soon, but that's definitely playing Russian roulette. All right. So if I go to, I still think it's the fastest route to the UK, to be honest, but this is dependent on your situation, how soon you need to be in the UK, or if you can have time and all that. So one disadvantage of the PLAB market is there's actually quite a high competition at the moment in the job market, in that all the people who had a backlog and who are completing PLABs now are looking for a job in a market where COVID is still challenging hiring and all that. All right. Two, PLAB examinations are not done in Kenya, so you actually require to travel, and that will, PLAB 1 can be done in many countries. Among them is Sudan. Probably the easiest would be Dubai in the United Arab Emirates. There's Egypt, Cairo, Nigeria, in other African. I think those are the African places. I don't know if there's one in South Africa, but I can stand to be corrected by this. Now, if you want to actually do the PLAB route, this needs to be started really soon, because it's going to be replaced by the UK MLA exam in the year 2025. And we do not know what that has. Basically, at least we know the PLAB, what it contains and all that, all right? So method number 2 is actually Royal College exams. So Royal College exams depends, specialty exams. So this is basically, if I want to become a surgeon, I'll do Royal College of Surgery exams. If you want to be a physician, will do Royal College of Physician exam. If personally, because I'm in pediatrics, the exam that I would have done if I was to come through the Royal College exams route would be the member of the Royal College of Pediatrics and Child Health. All right. So it has different parts. Most places will have different parts, and this will consist of 2 up to 4 parts, depending on which Royal College that you want to join or which specialty that you're going in. So I put here an example of members of the Royal College of Surgery, which basically has 2 exam parts, MRCS Part A and then MRCS Part B. Now, each of these exams is about £500, so that's £1,000 in terms of cost. But it varies from place to place. So of course I had to put my own examinations. So basically you can see for pediatrics, you actually end up doing 4 exams. And that's a foundation of practice, a theory and science, and applied knowledge in practice, plus a clinical exam later on. So the cost can be quite high depending on how many exams you're doing in the college. Now, the advantage is that entry into the UK will be, you can enter as a registrar. Well, consultants, typically they'd say yes, but typically what will happen is, despite being a consultant back home, they will take you back to ST3 position and just see how you're working there. And you will go up the ladder, and it will take 5 years before they recognize you as a consultant in the UK. So what was Dr. Omar saying is basically it's going to be very difficult to come in here as a consultant, even if you're a consultant back home, unless I actually don't know any case scenario where that is. Now, there's one of the advantages of doing Royal College exams, especially if you have something like a research background. You may have someone who is willing to sponsor you for GMC registration without completing all the college exams. This is an extremely rare event, and typically at higher levels, you may get some relocation packages available. I've seen, I think the best relocation package I've seen is £5,000. So basically they'll give you that to process your visa, to come and pay your first rent and pay your first deposit and just settle in general, all right? But this will not probably be given to junior doctors like I. Now, the disadvantages is, of course, this is specialty dependent, so you're not flexible. You cannot decide to do any job. You cannot do a member of Royal College of Surgery exam and end up in pediatrics or vice versa. I think it's a longer process before registration, just because some will say before you do like an applied or like a clinical exam, you need to have at least 3 years experience. You need at least a consultant back home to vouch that you have been in training or you have been in that specialty for at least 3 years or something of the sort. Now, fellowships, or what I call international training fellow, medical training fellow, basically is the third way. And these are usually based on a strict 2-year training on a tier 5 visa. There are usually 1,500 positions a year, which are fought over everyone who is not a graduate of the UK, and one must return to their country of origin after completion of those 2 years. So these programs, I really don't know them, but where I work, there are actually 2 of them that are here. Initially, your first 6 months, you will work at junior level, like an MO. Then the next 18 months, they'll give you a registrar level. And after that, it's just going to be added to your training. All right. So jobs, non-training jobs basically consist of NHS jobs. So NHS jobs, there's a single website that advertises for all jobs within the NHS system. And if you actually just Google NHS jobs, you're gonna see it's a blue website. I was supposed to share this, but I have not been able. I actually ended up leaving the hospital a bit late. Then the second type of job is a training job, where now I am. So training jobs, there's FY2 standalone job, which basically means you're in your second year of internship. Why I'd advise junior doctors, especially if you've only had 1 year experience after internship or just internship, why I'd advise them to come to FY2 standalone is the amount of support is quite significant, and you won't be given a lot of responsibilities. basically you will have someone overseeing you. The benefit of this is you will actually be able to learn the system without being given too much responsibility. Now, the other training job is specialty jobs like what I got now. Basically, I got my first year of pediatrics, which you'd get after FY2. And those training jobs are applied basically in another website. It's called Oriel, and I actually have those resources for you. So basically, you can apply for a training job, which means that you actually get a job, you're going to be paid monthly, but at the end of that training job, usually 8 years in the UK, you'll actually be qualified as a consultant, provided that you achieve everything that they needed to achieve in the curriculum and at the right time. So training jobs are applied in the same way as non-training jobs, except that it's a different site and a specific time. So applications are now open. However, they require you to actually have registration. So basically, you'll have your member of Royal College exams or your club exams, and you've got a GMC registration through that. Now, there is no master's or university that's providing this. Basically, it's like a COSESCA sort of logbook. I'd actually say it's like COSESCA. Basically, in a hospital, you have a logbook or achievements or things that you're supposed to achieve within certain times, and you just go through that system. All right. So basically, for pediatrics is a specialty ranking program. That's why it's ST specialty training from 1 year to 8 years. The benefit of this is, I know people are asking like, why are you doing 8 years of pediatrics? But my personal opinion was remaining home where I'd have to quit my job in a mission hospital, go and pay the university fees, then locum after that. Now I'm only worried about basically achieving my goals because the job is paid and I don't need to locum per se, and I don't need to pay any school fee. All right. So this is the resources. You can take a screenshot for anyone who needs to have these resources and hopefully get those websites. Yeah, and that was basically my presentation.
Thanks, Dr. Kamande. Let me ask you this question. Somebody asked, is it possible to get scholarship or any other kind of funding for the pre-registration courses? Listening to you, to Dr. Omar, Dr. Ngovo, Dr. Mohia, it is quite a costly affair. I mean, you really need to have funding or have prepared for it. So is there some scholarship or some sort of funding that one can get for that pre-registration period?
So typically, probably 90% of people will actually do this on their own costs. Mm-hmm. And just give me 1 minute. That's okay. Thank you. Yes. So yeah. So typically, that cost is typically 90%, 99% will actually fund their own. Sorry, I'm actually getting out, going home. I was supposed to be home by now doing this presentation.
No problem. Thank you for making the time.
I'm making the time. Anyway, so the cost is about 700,000 to 1 million Kenya shillings. My journey took about 3 years. And if you have to think about it, that's about 30,000 per month. I don't think that's something that a doctor won't be able to afford, although things have been getting quite challenging in Kenya. And that's one of the reasons I decided to come here. So that cost can be recouped even at junior level within 4 months of coming here. Mm-hmm. I mean, and that's bearing in mind living expenses. So I'd actually say for a doctor, it's probably one of the easier or easiest, what is this called? Investment that one can make. Mm-hmm. Okay. All right. So there's usually some funding and scholarships, but I applied for them and I did not get them. And I'm happy because they kind of bond you and they kind of limit what you can do when you come in the UK.
Okay. Thank you for that, Doc. I'll allow you to get home as we pick the other questions. This next one is for Dr. Ngovo. What if you have a master's degree in clinical pharmacy in Kenya? Is the process the same?
If you have a master's degree in...
Oh no, that is for Dr. Ngovo. We are allowing you, Dr. to get home.
Okay, so if you've got a master's degree in clinical pharmacy in Kenya, is that the question?
Yes, yes.
So as I said, so the process is not, okay, so are we talking about the registration process?
Yes, I think so, because that was one of our earliest questions. So I think it's the registration process.
So the registration process, there's no ways around it, whether you've got master's degree or not. Of course, it kind of makes more sense for the newly qualified pharmacist, but even if you have a master's degree, you still have to go for the overseas pharmacist program. They still want you to do that. So obviously a clinical pharmacy degree has got other advantages, but in terms of registration, you still have to go through the whole process.
Okay, thank you, Dr. And I think I'll ask this question to every one of us. Dr. Kamande, your screen is still on share. You can just unshare that if you don't mind. Dr. Ngovo, how is the paycheck like for an entry position in pharmacy in numbers?
So it's a difficult question to answer because first of all, it depends on which city you are in. But I'll just say on a rough guide, the starting salary of a pharmacist is around about £40,000 a year, which is obviously very generous in comparison to what we get in Kenya. And even with the living expenses, actually, is still a very good wage. Okay, so okay. Well, that's the starting salary. How far you take it is up to you, is how much you're willing to, keep pursuing opportunities and, getting out there and just pushing yourself. So there is really a lot to benefit from. Yeah, there is a lot of work to do, but if you're willing to do the work, there's money to get. Yeah.
Okay, all right. I think this I'll ask to Dr. Omar. What is the period it takes to do a surgical residency? I think you can just quickly touch on that because you had sort of said a bit about it.
Yeah, so generally what you kind of have to look at is the scheduling and the pattern for UK training. So typically you finish medical school and then you do foundation year 1 and 2. So that's kind of like your internship. And then from after foundation year 2, that's when you start specialist training. And that's why it's called ST levels. So you may start from ST level 1. So this is after the 2 years of internship. So ST1. So ST1 and 2 confers you the basic skills in that profession. So for example, ST1 in surgery or ST1 in medicine. Now they've increased that to 3 years. So your basic kind of learning the profession has been extended to 3 years. So you'll do ST1, 2, and 3 to become conversant with the specialty. And then at ST4 level, that's when you now specialize into becoming a surgeon, for example. So at ST3, you will do your MRCS exam, expected to pass it. So then you become a surgeon with the title of a surgeon, but you're not yet specialized, if that makes sense. You've got the basic skills. Now from ST4 or ST3, it could be anywhere to ST7 or ST8. So you're talking about another 5 years of training. So altogether, for most of the specialties in the UK, you're talking about 8 years after your foundation. So 8 years after the 2 years after med school, if that makes sense. So if you look at it from a trajectory point of view, so from finishing med school, you're talking about 10 years to become a consultant in many of them, in many of the specialties.
Okay. How easy is it to change jobs, especially from NHS to a training job?
Again, that's it's almost like a misconception. So the NHS is the biggest employer in the UK. So majority of my colleagues here probably work within the NHS. So either in primary care, that still be NHS, or within hospital. So that still will be within the NHS. Now, in the NHS, like Dr. Kamande has said, you can do a training post or a non-training post. So depending on what you do, you will decide what your journey is. For example, I'll give you my own experience. I did NHS jobs to begin with, so for about 4 years. So I did F2, I did a standalone FY2, so I repeated my internship. And then I did ST1, but CT1. So this is core training in medicine. So it's training to be a physician. And then I didn't like it. So I dropped it. And then I went into the other stuff that I've been doing. So the ease of changing jobs just depends on you. You can change however many jobs. I've not been in the same job for more than 2 years, but that's just me. You know, I'm not very, I'm not a committing person in terms of these jobs. But right now, I'm happy with what I'm doing. So I've done 3 years.
Mm-hmm. Okay, thank you for that. I promised to ask you, and maybe this I'll share out to all of you, and I can see a question around that. Are there no nannies in the UK? You said people should be prepared to be house husbands. And then there was another question about how easy or difficult is it for one to get their spouse to join them in the UK? So I think I'll just take that from all of you. And then the other one is on racism. There was a particular questions about your experiences on racism. So you can just touch on it briefly as well.
So if I just start with that, and then I'll let my other colleagues kind of jump in. So where do I start? So spouses. So you have to understand something, that the UK is a market for jobs. It's a big market. So even that nanny is looking for a job, and you're going to pay that nanny per hour, because every single person is paid per hour. So even doctors are paid per hour. So for example, as a junior doctor, you'd come in, you'd be paid about 17, 18 pounds an hour. And then cumulatively, you know, that's what ends up being 40,000 a year or 50,000 a year. Now, if you're paid 17 or 18 pounds an hour, the nanny that you're thinking to employ wants 10 pounds an hour to look after your child. So do the calculation. If you're working for 17 pounds an hour, you give the nanny 10 pounds an hour, then what's remaining? You've got to pay rent, pay for your car, fuel, insurance, bills, all of that. It's not going to be enough. So the easiest thing to do is one of you just stays at home. It's cheaper that way. Second question is how easy it is to bring your spouse. It's very easy, as long as one of you has a job which is earning you more than 21,000 pounds UK sterling, then you can bring a spouse. And then if you have children, for every child, I think it's 3,000 on top of that for every child like that. So it's easy to bring your spouse. The question of racism, it depends on who you are as a person to experience racism. You will see it. It is subtle. It's not in your face. You know, nobody will come and call you, you know, dirty black monkey. You know, nobody's going to do that. But you will see things like you're not invited to things, or you're not achieving that annual competence. So for example, you know, competence in doing an IV line. Somebody's taking you through 2 or 3 weeks just to sign you off for an IV line. You will just look at it. But for me, I will look at, you know, why are you doing that? Kama ni mzungu, within 1 hour, you would have signed them off. So it's things like that, institutional type of being left behind of things. You're not being promoted as your colleagues who are white British, for example. You're not being offered training opportunities. You're not being offered higher training opportunities. So these things are there. The racism that you're talking about that people fear is what you will see in the community. where somebody will stop you, for example, in the supermarket and say something nasty to you or to your child. These things are there.
That will help.
And what normally is the advice is you just have to learn how to deal with it. I know it sounds bad, but learn how to deal with it. For me personally, I don't take nonsense from everyone, but that's because of my position. My position and where I work, I can tell anyone anything. And hakuna mahali utanipeleka. That's the beauty of where I work. But for many people, it's very, very difficult. I hope that answers these discussions.
Yeah, I think it does. Dr. Ngova, you want to go next, please? Go ahead.
Yeah, I'll just add, I mean, Dr. Tayaria said really good points there. I'll just add one point about racism. The jobs that you will all be pursuing here in the UK sort of put you at a senior position. And in a way, you can somehow just ignore the racism because you're working at a senior position. So it's a matter of, I know I'm Black and I know maybe they do not actually want me to be doing the job, but they need me. I'm the pharmacist, too bad. So that way you just kind of are at an advantage because it's a job that they need. They can't do anything about it. So the rest of it, as Dr. Tayaria said, you just learn to ignore and just move on with life. Now, nannies and family. So yeah, it just not practical really to pay for nannies all the time. So you're going to have to bring up your own kids. But let me just say, actually, while that is an disadvantage, but it's also actually a strong point about family life in this country. You get to bring up your own kids. There's direct parenting. You're not going to you're going to show up for every single parents meeting. You're going to be there for sports days. So for me, while it's been hard in that I've got to scrub my own pots and cook every day, but you know what? I have experienced, I have been able to be involved in every single activity for my child. So for that, I'm grateful. And, you know, the years just go so quickly. Before you know it, you don't need that nanny. Your child is in secondary school. They're doing their own thing. And I have just been there for them. I've done all these school meetings. I've, you know, attended the sports days, and I have missed out on someone cleaning my house, but that's not the end of the world. So it's just like, you're going to have to give and take. That's what it is about living here. Yes, it's tough, but they're actually good points. You're going to have to talk to your husband, you know. There isn't time for men to hang out in the pubs like they do in Kenya. They need to get home because they will be looking after the kids. So while it's actually a down point, but it's also a good thing. The family life here, you got to make it work. It's as simple as that.
Okay, thank you, Dr. Ngova. Dr. Muhia, does the loneliness and the social life improve with time?
Hello. Yeah, I mean, I agree with my colleagues. I would say life is what you make it. I mean, I've got a good support network of friends. I'm very outgoing. So yes, I mean, in terms of family, there is very, very good points. You bond really well with your children. If you get out to make time for your friends and family, you will have a good life. So yes, it can be lonely initially, but I will say, you know, I feel like I'm home because then I've got family and friends surrounding me as well. But then I also get out and make time for them. So it's a two-way. The other point I was going to say is about racism. It can be very, very subtle. And I agree with my two colleagues. If you put your foot down, you're in a very senior position, they need you. If you're not there, the surgery is not going to run. So, you know, you put your shots forward. As long as you're following the guidelines, you're doing your job well, you know, nobody should be saying things back to you. And, you know, most trusts have inclusivity, diversity. There's now BAME groups coming up, which is the British, the groups for British and ethnic minority groups, people who are non-British. So while racism is sort of there in a subtle way, I've got colleagues in the US and they'll tell you it's right in your face. Well, here, I feel if somebody's being, you know, the British culture is very much, don't speak about it. You know, no, if you confront it, someone is going to really think twice, you know. So in terms of racism, I mean, I'm the BAME representative for our trust. And I think if you're in that position, you just nip in the bud. So it's fine. Some people in different roles, obviously, they do actually experience it in a very bad way. support workers, care workers, you know, because of course you don't have a voice, do you? But when you're in a place where it's a senior position, I don't think it should be a problem for any of the doctors coming here.
Right. Thank you, Dr. Muhia. Dr. Kamande, your own experiences, and somebody was asking about when you finish your training, what will be your title or what qualifications will you have?
All right. So I think I'm going to start with the second question. So when I finish my training, I'm actually going to be a consultant, and I'll be a member of the Royal College of Pediatrics and Child Health. And this is going to be recognized worldwide. The beauty of getting consultancy here is you can become a citizen of the world. They'll accept you in the America, Canada, Australia, and it's basically really well known. Now, to being able to actually do that, and every time that I go to my second year or third year, I'm getting a salary increment. I'm able to, currently I'm working about 48, 50 hours a week, which is a bit much, but definitely on my visa, it says that I have to work full time. I cannot choose to work until I become a citizen, which is gonna be in 5 to 6 years. And that's, for me, it was better. It was a much better deal to do 8 years with no financial worry than 4 years in Kenya where I'm coming to pay rent, you know. Now, when it comes to my experience, I've actually had a very lovely experience, and it started in quarantine, which was not lovely, but I was just talking to 2 individuals who are in quarantine, and they were white and they were very welcoming. And when I actually said I'm a doctor, they were really shocked, and the respect that comes with that, I think it surpasses the racism, and they are willing to listen and to hear you more, despite being a junior doctor, despite looking as young as I do, because even in Kenya, I still look young. Now, my first day at work, probably I noticed 50, 60% are not Caucasians. And I think this is all through the NHS. I mean, there's a lot of international medical graduates within the NHS. And so I might not say we take care of our own, but you will not feel like you are the only Black or minority person at work. Is there racism in the hospital? Currently, the experiences I've had is mostly from patients, and it will never be in your face. And I agree with that. It may be something of the sort of like, all right, these are the issues. So what are you going to do, doctor? Is there someone else who's gonna come and see them? And it's phrased in such a way that it's lovely. Let me say it's packaged well. The truth of the matter is I don't think racism in the UK can be fatal like it is in other countries. And there's definitely some safeguards against such racism, because any sort of violence, whether it's psychological or physical, against a doctor or any staff in the NHS is taken seriously, and they can actually prosecute someone who shows such attitudes towards staff in the NHS. So I'm feeling protected, honestly. Does not mean it's not there, but you may not suffer. Now, when it comes to, I've been in the UK for actually 2 months, so I've not known about basically how, when it comes to getting your, the cannula and all that, and getting your progression and all that, I'm not sure. But definitely one of my consultants is from Tanzania, and she's there, she's a consultant, well respected and all that. So hopefully it's not faced throughout.
Okay, thank you. Thank you very much, Dr. Kamande, for your insights. We have questions that have been answered on the Q&A. If you just want to run through all of those questions, we can't answer all of them, unfortunately, but we shall share a recording of this webinar to all your emails so that you're able to just have a look and be able to, listen in, especially if you missed out on any part on some of the questions that have been answered. We'll share this, and we'll also ask our panelists to share with us their presentations, and we'll send them out to you. I can see, Dr. Terry, you have a question about if somebody can be able to get to the path of, if they're in sports medicine, to get to being in the Premier League as a doctor. So I think you'll answer that. The doctors have put their email addresses, but we'll also share that so that you're able to engage with them on a one-on-one to get more insights about the opportunities that are there in the diaspora, particularly in the UK. Just a summary, we had Dr. Catherine Govo, who's a clinical pharmacist in the UK, Dr. Omar Tayari in the UK Navy, right? Is sports and wellness, Dr. Kamande pursuing his pediatrics training, and Dr. Mohia, who is a dentist in the UK. And I think we've all had a bit of new information, new ways or new insights into how it is to work in the UK or how you can access the UK. So that's where we'll end this webinar. I'd like to welcome our chairman, Dr. Kennedy Koech, to just wrap it up. And then we hope to see you in our next webinar. My name is Dr. Mercy Korir. Dr. Koech, please. Oh, okay, I think he dropped off. Is the chairman on? Okay, I think our chairman dropped, but that's where we'll end this webinar. In that case, we'll share, this is CPD accredited, so we'll also share the CPD points to everyone who was participating. Thank you for engaging with us. Thank you for staying with us for the 1.5 hours. My apologies, we spilled over by 3 minutes. But thank you very much. And thank you to our colleagues in the UK for making time. I know the time zones and everything, but you've made time and you've really informed us a lot about the opportunities there. So as a circle, the diaspora remittances, we are looking at growing our circle with you as the doctors in UK. Thank you very much. And I'd like to wish all of you a good evening and a good night from whichever part of the world that you're joining us from. Thank you and God bless.
Okay, thank you.
Thank you.
Thanks.
Bye, everyone.